many more ways to get involved and many more kind of entrance points into the community than there were then. And so it has become easier and easier. So Mary, I am going to go ahead and give you the screen and let you dive in.
Great. Thank you so much. Can you all hear me okay?
Yep.
Okay, great. Hi, my name is Mary. I am the ImproveCareNow communication specialist. I work alongside of my colleague, Sarah Nacito, and working a lot on the best ways to share all the great information and resources that we have. So I'm going to go through my slides very quickly and then actually launch onto our website where I can really point out where you can find some of these resources. So first off, hopefully everyone on this call has been on our website. You've been able to find this event and RSVP. So again, hopefully this is more of a refresher and I can point out some things you may not have seen. But first of all, our ImproveCareNow as our website in general is meant to be the hub to really connect the different places of our website or of our network. So you can find different tools as they become available, read our blog, learn more about research that's happening in the network, learn more about events and opportunities. So we really want the website to be the first place that you go to find these things. And Loop is our blog, and this is the official blog of ImproveCareNow where we tell stories about our community. And we have some really great stories coming from people like Shelley and people on the PAC and clinicians and registered dietitians and psychosocial groups, and we really try to get a voice from everyone in the network to really kind of be able to share what's going on in the community and what's going on as people live their life with IBD. We also have our events and opportunities page, which I will highlight, which again, hopefully everyone on this page has seen. And then go to our tools page and really show kind of where some of these resources, when they come available, where you can find them on our website. And then finally, we always encourage people to, if you're already involved in ImproveCareNow, how can you share what you're doing with somebody that you know, a patient or a parent or a colleague that may also find some value in what we're doing in ImproveCareNow. So I'll quickly show you where you can go to have someone get involved. With that, I'm going to hop out of the webinar. And as I said quickly, this is our website, it's ImproveCareNow.org. You can hop on here and be connected to tools on our website. Another thing I wanted to point out is our ImproveCareNow Spotlight. This is, we will highlight, right now we're highlighting the virtual community conference because it was our main event we were promoting. We'll be swapping this out with another, maybe a Loop post that we find that's really great, or if there's a volunteer opportunity, we'll highlight that. So just as you're going on our website, check out our Spotlight section to find out what's going on in ImproveCareNow. So again, if you go to Get Involved and Loop, this is where you can find our blog. If you really want to stay up to date with anything that, any new posts as they happen, sign up for our Loop updates. We just shared one yesterday, which was a really great recap of some of the graphics and images and stories that the PAC, the Patient Advisory Council, has put together leading up to our community conference. They share how they are better together and how they're collaborating with different parts with each other, as well as different parts of the community. So that's a really great story. We also have just a recap of our community conference, PAC stories, patients or parent stories. We have a really great one here from a parent. And we also recently shared some videos that were created by one of our centers. So Nationwide is one of our centers, and they produced some videos specifically about how to talk about or how to share what is inflammatory bowel disease, with each other and to a patient. And so they were able to share these videos that they collaborated with at their center, and we were able to share them with our community as well. So again, that is our blog loop. You can find that by going to Get Involved and Loop, and then also signing up to receive those posts in your inbox. Next, I will highlight the events page, which again, you should have found if you've RSVP'd to this event. Here it is right here. The other thing to say is this is events and opportunities. So as we have volunteer opportunities, as we have possibly even research opportunities, we're hoping to have more opportunities that we can also share on this page. So for instance, as we were working on some of our engagement trainings, one of the asks that we had was to have people help us review those trainings and go through them once before we open them up to the public. That is an opportunity that we would post on this page, hoping to find volunteers who can help us with some of these asks. We also are currently testing smaller Welcome to ImproveCareNow info sessions, very like this event here, but specifically for people who may have just signed up to wanting to learn more about ImproveCareNow and wanting to get involved, but perhaps they just want to learn a little bit more about who we are and what we're doing. So we're having a couple of these info sessions as well. And then more recently, and as Shelley described, we're working with the engagement campaign. We're testing more things with our centers, including having care center events. So if you are at a watch party right now, you may have found out about it from our care center events page. And these events really are more local. So we'll be posting events that are happening at the centers. So Dayton and Cincinnati Children's currently are having their watch parties, which is awesome. CHOA, which is in Atlanta, they've recently posted IBD family events that they've shared. And so this is a way that we're working with centers, connecting with centers, and trying to connect with our community at the local level as well as the national level. And then finally, I'll go through our tools page before I toss it over to the next topic, which we'll talk about a specific tool that the PAC is working on. But if you go to our tools page, this is really a hub of a lot of different resources that we have to help our patients and caregivers who are living with IBD. Smart Patients is a forum. It's another organization that we partner with, but it's a really great forum where caregivers and patients who are 18 years or older can connect and have conversations and really talk to one another and connect on that way in a forum. They do a really great job of both monitoring the conversation, but also just making connecting people of like diseases so they can talk and just talk about how to answer questions and connect with people who are going through the same things. We also have the Self-Management Handbook, which is a resource that was co-produced, and this is a really great resource that you can download as well. We have visit planners, and this is a way to, again, they're just documents that were co-produced by our community where you can download it and print it out and fill it out and bring it to your next doctor visit, and it can help guide your clinic visit. We have this one specifically for Crohn's disease as well as ulcerative colitis. And then our other areas are really compilation of different resources. So Growing Up with IBD has information about adolescence and body image, and sometimes these are links to a loop post that may talk about somebody who wanted to share their experience with that. The next tool that we'll be talking about is about body image and IBD. So it's kind of an update of what we have here. We also have some really great resources about talking about IBD. So the PAC has put together what they've called the Crohn's and Colitis Storybook, with their experiences living with IBD. They've also created a really great video series talking about why it's important to talk about IBD. We have resources about transitioning to adult care, and we have tools that are kind of in development as well that we'll be adding to this page as they're finalized. Some tools on college testing and accommodation, dorm room requests. You can see this is one. These are some of the PAC videos that they created. Why is it important to talk about IBD? How does IBD affect your mental health? So those are really great resources there. Staying Healthy with IBD has information from our nurses group about immunization and flu season. And then Eating Right has some really great resources from our registered dietitian group. So again, all these resources are co-produced and collaborated with different pieces, with different members of our community, and then shared here to help whoever they can help. Finally, if we have a toolkit or a guide or a resource that may not fit as easily in any of those categories, we have compiled them here in our toolkits and guide section. And so we have quite a range of toolkits here, from traveling with a travel toolkit that again was co-produced by the Patient Advisory Council and shares some tips and tricks and experiences about traveling. We have an ostomy toolkit, which also was co-produced and has tips and tricks and personal stories about living with an ostomy. The psychosocial group put together a how to find a mental health provider for your child, and this has some really great information to help if that is something that that you need. And then Clinical Research 101, as we're taking steps into more clinical research, this is a tool that was a collaboration with some members of our community, as well as the Crohn's and Colitis Foundation and NASCAN. And they're just videos and some resources to help to also talk to patients about what is clinical research, as well as parents. So I hope that you will take some time and look at our website and find these resources, and reach out if you have a story to tell. That is a great way to share, to contribute and to share more. And if you want to help co-produce the tool, reach out to us after the call and we can help make those connections. And I should have said in the beginning of my thing, and I realized I didn't, but if there was a tool or a story or something that really spoke out to you, something that you're excited to check out after this call, put it in the chat box. We'd love to see what you're excited about and what resources you think can help. Okay, and that's all I have.
Great. Thank you so much, Mary. That was a whirlwind tour. There's so much to see and do. And we just, like Mary said, really encourage people to get out there on the website and not only see things for yourself, but also, share at least one thing with somebody new, so we can help more people find the tools that they need. So we are going to turn it over to Missy. So speaking of tools, we're going to turn it over to Missy.
My name is Missy, and I'm a patient out of Colorado. I've been diagnosed for like 12 years now, so I have a little bit of experience with the disease. But I'm a part of the Patient Advisory Council and a co-lead with Rosa, who we work with an advocacy task force, who are largely a part of facilitating the development of toolkits. So we kind of just like get ideas and help develop them. So this is all about the body image toolkit. Mental health has been a big thing on our radar for a while. So we're kind of excited to get this one out in the ICN community. But this was first inspired by Catalina, our co-chair now, just to get some ideas about body image and just like kind of talk about what this means to an IBD patient. So as you can see, the purpose is mostly just to get support, ask questions, and really network with people, because we all are experiencing these things. Go ahead to the next slide. So what is a body image toolkit? So our primary audience is patients, and then of course parents and providers, but it's really for patients just to kind of get to understand that they're not alone. We wanted to compile some resources for patients to refer to and to be able to look back upon when they are having specific experiences. We touch on a lot of different experiences, so even if you're not experiencing it right now, the patient may experience it later. So I think it's a really good way to kind of just be able to come back and refer to. It's a really easy format. We did questions and answers, so we basically just made surveys, asked PAC members questions about their experiences with body image. If they had an experience with it, they would tell us about it. If they didn't tell us about it, or they just say doesn't apply, and then that's kind of how we put it into the toolkit. And then finally, there's a little bit of stats and a little bit of knowledge about body image and how that really impacts an IBD patient. And I think one really cool thing is that it was anonymous. I don't think it was initially intended to be anonymous, but I think it's really cool because people were able to really share how they felt. Next slide. So we have 5 sections that may or may not have changed in name as we are finishing the last editing stages, but one of them is common experiences. So just like common things that we all experience. So like prednisone is one of them, like the moon face. So that was something that we touched on. Therapies or medications and how those, which goes into prednisone, but how that impacts us. Surgery, body changes, just like body changes would be like weight gain, weight loss, and then emotional factors, like how we view our bodies and how that's impacted us. So again, it's question and answer style. And then something I really like about it is that we put summaries at the end of each section. So it's kind of a big toolkit, but it's kind of nice that people can just refer back to the summaries as like some little advice for them to kind of move forward from an experience. So right here I have just like a screenshot of one of our pages. This was in the earlier stages, so it looks a lot more clean now, but like the question we asked was, how has IBD medication impacted your body image? And then we got a lot of really cool responses. As you can see, prednisone and moon face is right there, talking about TPN lines and how that really impacted. I think the responses we chose also are very impactful to the questions we are asking. Next slide. And then here is an example of one of the summaries we did. So again, for the medication and IBD treatment effects, I thought it was really great, again, because we like summarized ways that someone can move forward from these experiences. So like asking questions about the therapies, I think is really important as a patient, because sometimes you don't really understand why you have to take it if it has such bad side effects. So it's kind of a nice thing also, just like talking about possible side effects, either with your provider or your parents or whomever. Then also we talked about like being uncomfortable and then reaching out to IBD patients. It's kind of a plug for the PAC, but also just like reaching out and having community. So we did that like on each section. Next slide. So finally, this is in the final stages, so now we're trying to promote it. So ways we've kind of tried to promote this is through the exchange. Me and Rose are currently in the works of writing a loop post talking about this toolkit. We're hoping to get it into ICN centers and then hopefully social media. So if anyone has any ideas of ways that we could promote this further, we'd love to find out or get some of that feedback. Next slide. So if you have any questions or comments, that's basically it. We're really excited about this. Let us know if you have any feedback or any suggestions for promotion. That's it.
Thank you so much, Missy. So thank you. That was a really nice kind of both starting with Mary's tour of the overall website and all the great tools and resources out there, and then a really nice deep dive that you just gave us into one tool, which we have gotten, we're hearing a lot of positive things about. So thank you so much. I'm seeing there are a couple of questions or actually one comment in the question box. Lisa Pitch, who happens to be our next speaker, said, I think we need a tool for parents that helps them transition away from their pediatric GI as their child enters adult care. It is traumatic. Lisa, that's a great suggestion. So other suggestions for tools, we're really excited to either help people, take them and run with them, or to share them with our PAC and parent working group so they can consider kind of getting them in the queue. But Lisa, I love that suggestion. We have a couple of minutes for questions if anybody does have questions about any of the content shared by either Mary or Missy. And you can use the chat box. You can ask us to unmute you. Any questions or clarifications are more than welcome. Ideas for other tools that you sort of, as you're perusing all of the resources out there about pediatric IBD, you're thinking, wow, I really need a tool for this, or suggestions for this, and it's kind of not out there. But like we said, we'd love to hear those. We have a whole sort of army of folks who love working on these things together.